from the doctor's knowledge. I'm here today to demonstrate the oxygen administration. So first is procedure. Assess patient respiratory rate and level of consciousness. Oxygen depletion will decrease respiratory rate and mental status and elevate PaCO2. So, i-assess na to ang ato ang patient. Mag-RR ka ron. So let's assume that the R of my patient is 25 cyclic beats per minute, so kinahanglan niya administer of oxygen. And assist pa na to ang level of consciousness sa ako ang patient. Sir, pwede pa inom sa full input mo?
With January Nizar.
Imong birthday, sir?
February 2004.
Kabalaw na ba, sir, kung asa ka karon? So, based on the sir, ang iyang level of consciousness is alert. So, the second is determine current arterial blood gases if available. Post this moment sign on the door of the patients in the view of the patient and visitors. Oxygen support composition. There are always danger of fire when oxygen is used. So, mga ni ang sign ng no smoking, and let's assume na mga ni ang perta sa pasyente. So, butang na ito yung area. So, show the nasal cannula to the patient, explain the procedure, and explanations relieves appreciation and promotes comfort. Sir, modern niya ang nasal cannula. Sir, diri mag-agi ang oxygen, nagikan sa oxygen tank na para mas dali ang imong maginawa. Make sure that the humidifier is filled to the appropriate mark. If the humidifier is not sufficiently full, less moisture will be delivered. So our humidifier is ready to use. So the next is check the oxygen tank by turning on the regular gauge to determine the amount of the oxygen on it. So let's just show that the oxygen tank is already turned on. So attach the connecting tube from the cannula to the humidifier outlet. Oxygen forced through the water is humidified to prevent dehydration of the mucous membrane. So mao ni ang tube sa cannula, i-connect natin ni sa outlet sa humidifier. And the next is set the flow rate at the prescribed liter minutes to determine if oxygen is flowing through the tips of the cannula. Approximately oxygen concentration by the nasal cannula delivered by the nasal cannula are 1 liter is 1 liter equivalent of 24%, 2 liters equivalent of 28%, while the 3 liters is equivalent of 32% and 5 liters is equivalent of 40%. So let's assume that the prescribe of the doctor is for doctor to the patient is 5 liters. So place the tip of the cannula in the patient nose, passing tubing around the client heads or behind each ear. Position the cannula so that the tips do not extend more than 2.5 centimeter or 1 inch into the nurse. Correct placement and faster facility oxygen administrations and comfort to the client. Yes, sir, magbutang mo parang kuhan, sir. Pagila, sir.
Nato kasi kina. Wala na lang
then adjust flow to prescribed rate. Encourage patient to breathe through his nose with his mouth closed. Keeping the mouth closed provides optimal delivery of oxygen to the lungs. Okay, sir, ginhawag lang sir sa nose, sir, tapos i-close na ang baba, sir. The next is determine patient comfort with oxygen use. Flow rate excess of 41 per minute may lead to air swallowing and irritation of the nasal and pharyngeal mucosa. If higher concentrations are required, consider on alternate fall-off therapy. And the last is record flow rate used in patient response. So this is the end of my return demonstration.